Alright, so we're going to have a couple of videos here on the appendicular skeleton, the upper extremity, and the lower extremity. This video is about the upper extremity and the bones that hold the upper extremity and secure them to the axial skeleton. If you remember, the bones that secure an extremity of the appendicular skeleton to the axial skeleton are called girdles. So there's an upper and a lower extremity girdle. The girdle of the upper extremity is known as the pectoral, also called the shoulder girdle. Okay, it's the upper extremity. Called it the lower extremity girdle. The structure that holds the leg or the lower extremity to the axial skeleton is called the pelvic girdle. We'll talk about that in the next video. Okay. But today we're going to talk about the upper extremity in this video, the shoulder girdle, and the bones of the upper extremity. Okay? The shoulder girdle is made of two bones. Okay? Clavicle and scapula. That's commonly the collarbone and the shoulder blade. From here on out, I'm going to call it the clavicle and the scapula. The only bone that directly articulates or attaches the upper extremity to the axial skeleton is the clavicle. Okay? The shoulder blade is encased in muscle. It does not directly form a joint with any bones of the axial skeleton, but it is an important part of the shoulder girdle, as I'm going to explain. But the only bone that connects the upper extremity to the axial skeleton is this S-shaped clavicle. Okay? And what you're going to find as you think about this and read about this and as we talk about it, that's not a very sturdy or secure connection. But the trade-off is a tremendous range of motion. So for the upper extremity, think about all the ways you can move your arm. Think about a pitcher winding up and throwing a pitch and all the movements that go into that. So what it lacks in stability, it makes up for in range of motion. And the opposite is true for the pelvis. We'll talk about that later. Okay. Yeah, you're going to hear a little bit of baby and TV show in the background, but that's okay. So first let me tell you about this clavicle. Okay. This is a superior view of a clavicle. This end is medial and this end is lateral. Okay. So this is if you were looking down on the shoulder from above. Okay. And ask yourself, what is the lateral end of this, or I'm sorry, the medial end? What does the medial end of the clavicle articulate with? Okay. How exactly does the clavicle attach to the axial skeleton? Medially, it forms a joint with that superiormost portion of the sternum, called the manubrium. Okay, remember that there's a jugular notch here in this shield-shaped manubrium. Okay, so there's a jugular notch in the midline, and just lateral to it, there's a surface that the clavicle articulates with. Okay, this thing is called the SC joint. SC, that's the sternoclavicular joint. This right here is the only area where the upper extremity directly forms a bony articulation or a bony joint with the axial skeleton. Okay? Just while we're here, remind ourselves that this portion of the sternum is known as the body, and the inferiormost portion of the sternum is the xiphoid process. This is a shield, this is the body, this is the sword, the xiphoid. Okay? So this medial end of the clavicle is called the sternal end. Okay? That's the sternal end. It's the end that articulates with the sternum. It's the medial end. The opposite end of this bone, the lateral end, is called the acromial end. And if you're not already, I really think that you guys should be following along with an atlas or with your book or with the slides. just so you can see pictures and see maybe a better view of what I'm explaining here. What you have here is a medial sternal end and a lateral acromial end, okay? The acromial end refers to the part of the scapula that this bone articulates with, okay? The part of the scapula that this bone articulates with is called the acromial process, or the acromion, okay? And the joint that is formed here is called the AC joint. The AC joint. That is the acromioclavicular joint. So you guys are going to hear sometimes about AC joint separation, SC joint separation. That's what it's talking about, okay? So the names of these ends tell you what it articulates with, okay? What it forms a joint with, okay? Remember that there's a third marking on this bone that's on your list. It's called the conoid tubercle. Conoid tubercle. The conoid tubercle is on the inferior and posterior aspect of this bone. So if you're looking at the superior view, sternal end, acromial end, superior view. If you flip it over, laterally, posteriorly, and inferiorly, there's a bump here. It's a tubercle. It's the conoid tubercle. This is an attachment site for ligaments of the shoulder. Okay, it's on the inferior, lateral, and posterior aspect of this bone. So if you know all of those facts that I just said, you can figure out which side this clavicle belongs to. It's the left clavicle, okay? So if you were looking in the anatomic position, you'd see a clavicle like this, and if you feel on yourself, medially, just lateral to your sternum, at this level, you're going to feel this anterior projection of this joint. And if you put your fingers just lateral to your manubrium and shrug your shoulders, you're going to feel, quite a bit of free movement at that joint. I don't have a sternum here, or I'd demonstrate. All right, so that's the clavicle. Okay, 3 parts. It articulates with the scapula. Okay, scapula has some more important parts that I'm going to tell you about. Okay. First part I want to circle back around to, or first maybe let me just orient you a little bit. You see this scapula has a very smooth, broad surface, okay, inferiorly. Superior and laterally, you see this projection that looks like a bird's beak. Okay. This is the coracoid. That's not to be confused with the coronoid process of the mandible. Okay, but this is the coracoid process of the scapula. It's a crow's beak. That's what it means, and that's what it looks like. It's the beak of a crow. Okay. Posterior and still superior, you see this process called the acromion. A-C-R-O-M-I-O-N, acromion. Okay, it's a process. Remember, a process is a general word for a projection of bone, or a poking out of bone. Okay. And it's very smooth. This is the anterior surface of the scapula, okay? The clues are a very smooth, anterior, broad surface here, and the coracoid process, okay? If you turn this over and you look at the posterior part of this bone, you're gonna see a horizontal shelf of bone. This is called the spine of the scapula. This is not the spine of the vertebral column. This is the spine of the scapula. Okay, it looks a little bit like a shelf. You could rest a pen on it. Okay. And if you follow it laterally, the lateral termination of the spine of the scapula is the acromion. So if you travel laterally all the way, following the spine, you reach the acromion. Okay. This is posterior. This spine, this shelf, is dead giveaway that this is the posterior aspect of the scapula. And that's how you tell if this bone is a right or a left. You hold it anteriorly. You say, I'm looking at a patient in the anatomic position. The acromion is posterior and lateral. The coracoid is anterior and lateral. This is the anterior. This is a left scapula. If you look at it from a medial view, from a lateral view, the lateral edge of the scapula has this cup-shaped cavity. Okay, this is the glenoid cavity. It's where the head of the humerus sits. This is actually a right-sided humerus, but if you use your imagination, the head of the humerus sits in the scapula like this. Okay, that's the glenoid cavity. It's not much of a cavity, but lots of ligaments and muscles of the shoulder hold the humerus onto this bone, and it allows the humerus and the entire upper extremity to rotate in all different directions. And all of those cuffs, that cuff of muscle and ligament, is called a rotator cuff. Okay, it's a cuff of muscle and ligaments that allows the humerus to rotate in all sorts of directions. That's a type of ball and socket joint. It's the glenoid cavity. That's a glenoid, Glenoid. Okay. So what we have here is a left scapula and a left clavicle. Okay, and that's how you know which is which. The other, shh, don't tell. I'll get a wipe and clean that off. The other important parts of this bone that you're going to see on your handout are some fossas, which are depressions where muscles sit in and attach. Okay, there's three important fossas in this bone that I'm going to point out. When you're looking at this thing from the anterior view, this really large, broad anterior fossa is for a bone called the subscapularis. This is the subscapular fossa. Subscapular fossa is anterior. Posterior, there's two, okay? There's a superior fossa. That's where I set this pen earlier. It's almost like a shelf. It's superior to the spine of the scapula. It's called the supraspinous fossa. There's a muscle that rests in and attaches to this part of the bone called the supraspinatus muscle. Okay? Inferior to the spine of the scapula is this large inferior and posterior fossa. It's for a muscle. It's called the infraspinous fossa. Okay? Supraspinous, infraspinous fossa. Supraspinatus muscle, infraspinatus muscle. Okay, it's in the name. Don't confuse the fossa with the muscle. A fossa is a depression in a bone. Okay? And what occupies that depression? It's the supraspinatus muscle, the infraspinatus muscle. Okay. Hey, baby. So, to review the... Hey, baby. We're looking at the scapula. Okay. So the parts of this bone, anteriorly, subscapular fossa. It accommodates the subscapularis muscle. Okay, as well anteriorly, we have the coracoid process. Laterally, glenoid fossa. Posteriorly, interspinous and supraspinous fossas. Spine of the scapula, and the lateral terminal end of the spine is going to be the acromion. Okay, that's the scapula. If you know those things and you know their positions, in fact, really you need to only know a couple, then you'll be able to orient yourself and identify this as a left scapula. Okay.